We are now open for question and answer. So we will begin with our first question, and this question is open to all panelists. And the first question is essentially, as a health professional, how do we get started? Where should we start if we're interested in implementing telemedicine services at our practice?
Dr. Branson, did you want to share how you got started?
Yeah, definitely. I think Marcus might be the best person for this because this is like, I'm sure there's a team working behind me doing all of the work, and I'm just like scheduling the patients and seeing them. But it does start with a great clinical support group, depending on if you're in private practice. They also have inpatient telemedicine and telehealth. I have to say I previously worked in Boston. It was a little bit more challenging to get the telehealth started at that location compared to here because, as stated before by Megan, you know, there's just such a shortage of physicians, and it's just a larger state and area, so there are more locations that are needed to be covered, and there are just not enough physicians. So basically, I was able to get started through the clinical team at Morehouse Healthcare, and they were able to get me started enrolling that way.
Well, to piggyback off what Dr. Branson was saying, it's definitely, once we identified that there was a need for telemedicine, we started exploring those opportunities and then kind of looking to see what our, you know, peers in the industry were doing, and that kind of solidified things for us. I think one key thing that you have to take away from the telemedicine piece is that none of it will be easy. And every turn that you make, there's an obstacle. And so just being flexible and understanding that, you know, the best results come from those who actually are dedicated to improving patient care.
Yeah.
And I found that to help significantly.
Yeah, just to add to that as well. I mean, some of the, like I said, a lot of this is generalized. So you have to find a program and telemedicine, telehealth provider or services support group that works best for you and your clinical field or background. You know, while there may be incentives for one, there may not be for another, you know, so just evaluating that and making sure that you find one that works best for you.
And the only thing I'll add to that question, and that's why I kind of started with the approach of who you want the payer to be, and I know that's a process that has informed a lot of practices, you know, getting started, is sometimes it's easier to start with patients paying out of pocket, but then that changes what type of patients you're able to actually see with the technology. But then, you know, understanding, you know, step 2 might be which payer are we going to have the easiest way to actually start billing. So, you know, understanding that the rollout may be step by step, and you may start small to just pilot and then continue to grow and learn as you're evolving.
Thank you. And I want to apologize ahead of time. I noticed that the email addresses are incorrect. We will provide via email the email addresses to Ms. Douglas, Dr. Branson, and Mr. Smith. So please do not send the email to those accounts. Okay, so moving along to the next question. So Ms. Douglas, we received...
There is an echo.
Excuse me, there was a bit of an echo. Okay, we received a handful of questions regarding litigation. So, is there increased litigation or risk of litigation when providing healthcare services via
telehealth? This has been a concern since telemedicine first started, and it seemed to me that it was a concern with not a whole lot of evidence behind it. This is not an area that I really track closely, but I do know that, you know, the insurance, insurance covers have specific telemedicine provisions, and I know it's definitely on the mind of those who are concerned about the liability aspect, but I'm not aware of what the situation is with lawsuits or whether patients have been suing and or been winning any lawsuits related to telemedicine. I do want to take this opportunity to maybe shoot the myth down that we do live in a litigious society, because most patients who are injured by negligence do not sue, but that's the only talking point I'll share on that right now.
Okay, thank you. So this question actually may be open for all of you, but I'd like to start with Mr. Smith. So Lynn notes that physicians from other states are not allowed to practice in Georgia, but she would like to know about nurse practitioners or physician's assistants.
It applies to them as well. So I've been doing a little bit of research with how the VA's model is kind of structured, because VA nurse practitioner in Georgia can see a patient anywhere, and just trying to research. I don't have a definite answer for that, but I am currently researching to see how is it that they can see a patient remotely anywhere, and providers and other healthcare professionals within the organization in a state are limited to just seeing patients within that state. Now, it's different, if a patient actually travels, because we've had a patient travel outside of the United States and we've seen them, but their home of record is actually in Georgia, so that encounter was okay. So I don't have a better answer.
And I would imagine that just like the licensure requirements for physicians are state specific, that the licensure requirements or supervision requirements, because I know Georgia is stricter with regard to supervision of NPs and PAs. So depending on states and what their state laws and how flexible they are with the scope of practice, there may be differences there.
And I've pulled a list, because I try to track this, pretty frequently. I've pulled a list of kind of where all the 50 states are in regards to telemedicine as it relates to how restrictive that state is, how moderately open to telemedicine that state is, and those states that have been doing progressively well. So I can send those out to everyone. I think it's great information to kind of see, where you pan out. I'll send that out at the close of this webinar.
Thank you so much. Okay, so we'll move on to our next question. So Cheryl would like to know, how does Incidence 2 billing affect telemedicine service providers or service provision?
I don't think I...
And if you don't have an answer, we can always go back to that one. Okay.
I'm not familiar.
Not a problem. So we'll move on to the next question.
Yeah.
And actually, this is a question for all panelists, and I would like you to answer from your perspective. And Ms. Douglas, if you can answer from the perspective of a researcher in addition to a legal professional.
Thank you.
Okay, so the question is with regard to developing a formative evaluation strategy to determine whether or not your practice or your patients are ready to receive telemedicine services. So is there a formal needs assessment or a formative evaluation strategy which should be implemented? And I see all of you shaking your heads, so the answer is yes. Mm-hmm. And what is that? What is that?
I guess I'll start. Yes, definitely. As a clinician, from the clinician side, you definitely have to see the patient. I typically see all of my patients before suggesting a telemedicine or telehealth visit initially, just to get an understanding of why they came in and what their initial evaluation is for. And second, you don't want a person or a follow-up patient who would have multiple reasons for the visit. Once again, there may be a time constraint depending on your telehealth visit. So if it's 15 minutes, you can't discuss multiple different issues. So typically, ideally, you would have seen the person initially in an initial evaluation and then follow up with them for whatever you're doing. If it's for treatment, in my instance, would be migraines, right? I evaluate them and determine if their medication is helping or working. If not, then we can switch it to another one. And that shouldn't take more than 15 minutes, depending on the level of severity for that particular problem. So you have to have some sort of plan or idea of what you want to get out, what you want to, and for the patient to get out of that particular visit.
Okay, so from my perspective, I think that we have to look at it from two different perspectives, and honestly, you have to consider your audience from those perspectives. So Generation Xers are more so one-on-one with their providers. You know, they love to see face-to-face, while millennials are more so, hey, I need to see somebody like yesterday, and I want it to have already been over. You know, so they're more so open to technology. What you have to consider with both audiences is that you want to create a telemedicine encounter that's identical to them actually being in your room. And that makes it a lot more comfortable for that, that patient to say, hey, I feel like they heard me, they addressed all my concerns, all my needs were met. And you want to follow all that up at the end with a questionnaire. It doesn't have to be a long, drawn out questionnaire. It can just be a couple of questions. How do you feel that we perform? You're basically fishing for the answers to help you improve what you currently have in place, if that makes sense.
So, and I would say, I think the question did start with or mention something about a needs assessment, and I think that is really important. And I think it's really important to assess the needs from the patients, from the community of providers. I mean, especially when you're thinking about serving rural areas, or if you're a rural area, thinking about who might the distant providers be, and what is the capacity within that community that you might be wanting to partner with. And then, what is the need within the providers that are currently in the practice? And I think that the answers to those questions would be all very different. So finding, what is going to work and meet the needs of all three of those different types of stakeholders, it would be the challenge, but that would also start this ongoing conversation and relationship that would help in the evolution of the service. So, I also have to include the policy side of the evaluation in this question. From a public payer perspective, and Medicaid specifically, things like how far are patients currently traveling, and for Medicaid that pays for transportation services to appointments, identifying how a telemedicine program has either changed the amount of travel that people have to do, whether that be their time or their distance in miles. Those are key factors that are going to be important for advocating for better supportive policies within the state to be able to demonstrate where the state may be saving money, or where there are, there's literally no specialist within a certain mile radius, demonstrating that this patient may have foregone care completely, but now by telemedicine they're able to actually receive care. Those are the kinds of points that payers or system level people are going to be interested in finding. Obviously, the patient outcomes and being able to show whether there are differences in providing those in-person services or via telemedicine. And I do think the use in the technology is still young enough that we're still learning a lot about what is the most appropriate type of service to deliver via telemedicine. I think we're also, it's been really interesting to follow this over time, where the utilization, lots of people had the technology, but utilization and how often providers were using the technology was lagging behind a lot. And so we've definitely seen that utilization increasing, and some of the recent literature has really pointed to some of the programs that, the reasons that patients are interested in telemedicine is that convenience factor. So figuring out and designing programs that that really, support that convenience factor. Again, thinking about that may serve a different patient population than a lot of us who are focused on underserved communities may be caring for. So, that issue definitely comes into play. But lots of room for evaluation and very important, especially for growing this type of service at the practice level or, at the system level.
Thank you. And that was a very comprehensive answer. Thank you for that question. Excuse me. Thank you for that response. Dr. Branson, we have a question from your perspective since you have excelled as a clinician providing telemedicine services. So one respondent would like to know, what services do you believe to be ideal for telemedicine implementation?
It does depend on your field of expertise. Right? Stated before, I'm a neurologist. So typically, I wouldn't have someone who had an initial evaluation of a stroke assessment do the telemedicine visit. But if I've seen someone in my clinic before for a headache and I'm treating them with a medication and I'm just following up to see if that has helped, then I don't mind doing a follow-up. And sometimes you can say, oh, I'm not sure if this medication is going to help cover them until our next visit, so then maybe I'll do a 6-week visit to evaluate that. So you want to assess the person's capabilities, like stated before about the differences between the millennials and the Gen Xers. If they are comfortable with using telemedicine or telehealth, a computer or phone or iPad or whatever screen that they would use, and if they do feel comfortable with accessing that and going through that and downloading that information in that software. So even if it may be something simple, I may feel that the person may not feel as comfortable, and you can always ask them. As stated before, also location, Georgia being a much bigger state, if they're fighting traffic and they come in and their blood pressure is really high and they said, I was just, in traffic sitting trying to get here, and I've caused another problem when they're trying to come for management or care. So you want to offer that as an option so that they won't have to fight traffic or sit in the, Georgia's heat or whatever way that mechanism or way that they have to get to your clinic to see you. So you want to look at all of that and then look at your schedule and your time as well and determine if you are comfortable with doing a telehealth or telemedicine visit, making sure you have an assessment evaluation that you have in front of you as well, because it's new, it's different, and it may seem, people may make it feel like, oh, I'm talking on the phone, but you really have to do your due diligence and document everything that you're talking to them about. So you still have to do some of the same things that you're doing as if they were in the clinic, and that we may forget that because this is all new to us and it's a new device. So just making sure that the patient feels comfortable and that you as the clinician also feel comfortable with performing the initial, the follow-up evaluation.
Thank you. Okay, Mr. Smith, I have a question for you. I know we're coming close. Do all payers reimburse for telemedicine visits?
It's kind of a loaded question. So it depends on the payer, really. And the reason why I say it is because we found out that, I'll give you a current example. We were not being reimbursed from Cigna for our telemedicine encounters. And so after a little bit of research, that's how we found out that Cigna had partnered with MDLive and Amwell, and they had chosen them to be the only platforms that they would reimburse for a visit. And it kind of put us in a little bit of a bind, because the only option that we were able to offer patients that had Cigna insurance were cash paying options, self-pay. And that worked, but if you pay for, if you're paying for insurance, you want your insurance to cover your visit, And you also have to keep in mind that if that's a scenario that you're currently dealing with, you have to have them sign a waiver, and the waiver basically has to state something along the lines that later on I would not go back and use my insurance to cover this visit. because then that creates a pull effect. You know, you got to reimburse the patient for the visit because they paid you a flat rate, and insurance says that, hey, I have a copay of $25. So if you charge them the flat rate of $50, now you owe them the difference. And so those are some of the issues that we found. With Medicare, Medicaid, they're a little bit more tricky. We would not be reimbursed for telemedicine visits simply because we're not in a underserved area. If you are in an underserved area, you could be reimbursed for those visits.
Medicare.
Yeah, right.
Phenomenal. And Ms. Douglas, I saw you shaking your head. Are there any points that you'd like to add to that question about reimbursement? Does everyone reimburse? Do some people reimburse? Is it
so I'm surprised a little bit to hear about this instance with that Marcus is discussing with a private insurance company, and that sounds like the types of things we were hearing when the payer parity law was first passed in Georgia. It doesn't sound like that would comply with what the Georgia law is, but again, I'm not providing legal advice here today. I do in Georgia, I mean, given that we have the private payer mandate, our Medicaid program pays, and then yes, Marcus did hit on some of the Medicare limitations, but yes, in my view, all payers would be paying. That doesn't mean that we don't have a number of telemedicine programs that do rely on patients paying out of pocket, and that's that's been trending a lot lately. But short answer would be yes.
I would also like to add that really quick, I would like to end-stage renal disease, Medicare will pay for telemedicine visits for those.
Thank you. Well, we have reached the top of our hour, and I know Dr. Branson has to leave, so I will ask Dr. Branson, do you have any closing thoughts? And you may
okay, sorry about that. I just wanted to add that telemedicine is a great opportunity for patients. I can tell you so many stories. One patient had the view of his backyard as a scenery and setting, and it can really help with de-stressing. And for the patients, they feel more comfortable and almost like you're a part of being there, like going back to those days when you would do those house visits or house calls, and you can see a lot of different things. You can see if they're home or depending on where they're at, where they're having the visit is and just what their other issues that might be causing some of the problems that they're having. And there was one other question about psychiatry. But yes, it does depend on the acuity and if it would be appropriate for, I think the question was, would it be appropriate for telehealth? Definitely psychiatry would definitely be appropriate for telehealth. It just depends on the acuity level. If it's really acute, severe depression, active suicide ideation, that would not be appropriate. But if it's something stable and you're continuing to monitor along, yes, that would be appropriate. But thank you again. This was a great opportunity, and I really appreciate it.
Thank you. And I will ask Ms. Douglas for her closing thoughts, and I'm also going to ask you to plug the research work that's being conducted by the National Center for Primary Care, and then I will ask Mr. Smith for his closing remarks, and I will ask you to plug all opportunities to partner with.
So thank you for putting this webinar on. I agree that telemedicine is absolutely beneficial for patients, for payers, and for providers, especially when you can figure out those parameters that really make it work. I will plug some of the NCPC work. What I mentioned earlier, the examining health IT adoption, and telemedicine is one of those digital health solutions that we will be asking about. But we will be starting a big marketing campaign to get people to take our survey sometime in September is the plan. So hopefully if you receive an email from us to take the survey, you'll be willing to share what types of health IT you're using, and we are defining that very broadly, from the use of electronic medical records to patient portals health information exchange, apps, Fitbits, things like that. So really trying to be very broad and inclusive and see where technology is going in the future. So yes, hope that you'll be able to participate with that. Thank you, everyone with Morehouse Healthcare, and thanks to the other presenters as well.
All right, so I guess that leaves me. All right, so initially when I heard about the telemedicine opportunity or idea, I was ecstatic about being a part of it. Last year I was able to attend the, I think it's the ATA, American Technology Association. Telemedicine, I'm sorry. Thanks for correcting me. I was able to attend, it's all right. I was able to attend that, and I found out a ton of information. You're able to communicate with, other individuals that are going through the same thing that you're going through. Some are a little bit more advanced. Some of them are a little behind. But, you can offer advice. You can receive advice, and sometimes you can kind of collaborate and share ideas, which is phenomenal. I would like to leave these closing remarks is that CMS is working very hard to streamline the telemedicine, telehealth criteria for reimbursement. All right, so that's including the clinical performance, member experience is high on their list, drug adherence, operational efficiency. Basically, be the best that you can be at providing the best telemedicine experience that you can provide. And so with that, that's all that I have. Thanks for the opportunity. Thanks to the other presenters. It was a fantastic experience.